The topic that we are going to present is Cadet Expert System for Early Cancer Detection. In this presentation, we'll introduce what is Expert Systems Cadet, why do we need Cadet, general description of the Cadet system, knowledge base of the Cadet, interference engine, its user interface, and evaluation of the Cadet system. Introduction. Cadet is clinical decision support system for possible detection and identification of cancer in its early stages in patients. It is a medical-based application of expert system in the vast domain of artificial intelligence. Cancer risk detection and risk evaluation are subject to serious limitation mainly related to human factors and characteristics of type of data involved. Cancer screening aims to detect cancer before symptoms appear. This may involve blood tests, urine tests, DNA tests, or the test or medical imaging. So how basically Cadet works? Individual data obtained from the patients through a questionnaire are input into Cadet, a computerized clinical decision support system. A report summarizing patient data and cancer hypothesis with a scoring system that reflects degree of alarm is generated. According to a major cancer society's guidelines, cancer screening remains the major tool in a cancer risk detection and evaluation as well as in early cancer detection. Textbooks of medicine, WHO cancer statistics data, and Medellin search is used as a data source for Cadet. How Cadet works? A computer-based system was designed to provide the physical physician with a clear clinical picture and aid in directing patients to appropriate measure. The Cadet system, as well as some preliminary results of the clinical experience accumulated in its use, are described. This preliminary results suggest that the approach may be useful in improving cancer risk assessment and screening in primary care setups. The CARET procedure has undergone preliminary trials in the United States and in Israel. It seems reasonable to recommend its use in healthy population above the age of 40. So what types of cancers are evaluated by CADET? So we can see here thyroid, head and neck, esophagus, stomach, skin, colon, liver, pancreas, gallbladder, kidney, etc. etc. And there are more cancer types of cancer that can be evaluated by CADET.
Components of Cadet Expert System. There are three components of Cadet Expert System: knowledge base, inference engine, and user interface. Now, what is knowledge base? Knowledge base is a collection of facts and rules. The knowledge base is created from information provided by human experts. There are four components of knowledge base: factual knowledge, heuristic knowledge, knowledge representation and acquisition, learning module. Now, what is inference engine? Inference engine acts rather like a search engine examining the knowledge base for information that matches the user's query. There are two types of inference engine: forward chaining and backward chaining. Now, user interface. What is user interface? This is the system that allows a non-expert user to query or question the expert system and to receive advice. The user interface is designed to be as simple to use as possible. Now, this is the diagram of an expert system where the non-expert user sends query to the expert system via user interface, and which in turn sends it to the inference engine, which acts as a search engine and searches the information which matches the user's query and sends the information back to the user interface, which sends it back to the non-expert user via advice. Types of data analyzed by the system. Epidemiological data. Examples include the prevalence of each cancer type in different geographical areas and age groups and genders. Symptoms possibly related to cancer in each of the sites considered. Physical signs that should alert to the possibility of cancer with special attention to the least frequent but important signs of potential cancer. Data items that are useful in the management of suspected cancer cases. And finally, risk factors for each cancer site such as familial genetic risk factors, example genetic factors in breast and colon cancer. Personal medical antecedents that confer increased cancer risk, example ulcerative colitis and vitamin B12 deficiency, and potential carcinogenic therapies such as previous chemotherapy. Occupational and environmental risk factors, example asbestos exposure. Risk factors related to personal habits such as smoking and dietary habits. Now, components of knowledge base. Factual knowledge, which are actually the facts and the rules. This knowledge includes epidemiological data, risk factors for each cancer site, symptoms, and physical signs. Now, what is heuristic knowledge? Heuristic knowledge includes heuristic rules which develop to characterize quantitatively clinical complexities in several domains, including age and sex dependencies and disease specific interactions among various elements of data. Now, what are the heuristic rules? Heuristic rules are used to identify the relationships of data to various cancer sites and manipulate basic epidemiological data into a case specific prior probability of the disease, integrate the weights of individual data with respect to each cancer site. Now, each cancer site in the system is connected to its own list of weighted data elements. The potential integral weight of various elements may therefore vary markedly among cancer types. Therefore, for each cancer type, this integral represents the maximum alarm index achievable by the tumor in question. FCF and HCF score alerts are used for further evaluation. Now, what is knowledge representation? Knowledge representation involves each piece of data was assigned a weight reflecting its predictive power in the diagnosis of each cancer. These weights are determined by experts in the field based on the literature data. Knowledge acquisition. What is knowledge acquisition? Knowledge acquisition refers to the process of extracting, structuring, and organizing domain knowledge from the domain experts in a program. For example, doctors in case of Cadet expert system. What is learning module? The function of this component or module is to allow the expert system to acquire more and more knowledge from the various sources and to store it in the knowledge base, and also used to acquire knowledge from its past experiences.
General description of cadet system. Individual patient data is elicited using a questionnaire containing several hundreds of data items in the following categories: geographic, medical, occupational, habit, familial risk factors, symptoms, and physical signs. The questionnaire is designed to be self-administered, obviating the need for medical and paramedical assistance in data gathering. The patient is asked to note on a reply form to only those questions to which the response is affirmative. The average time required to answer the questionnaire is around 15 minutes. Data entry can be done manually or through a screen or through a scanning device. The data is processed and the system outputs consist of a report which is used by the physicians. Second, optional questionnaire can be used by the examining physician for a cancer-related physical examination, and these findings are then processed along with the other patient data. Now the cadet algorithm. The cadet algorithm utilizes a multi-pass heuristic algorithm to pinpoint, weigh, and score potential cancers in the patient. It performs a number of iterations on the patient's responses. Each pass generates a series of physical parameters for further analysis by the next pass. The input for the next pass is the output which is generated from the previous pass. The algorithm operates in 5 phases. The first phase is the cancer hypothesis generation. In this phase, the data is gathered for various types of cancer and its symptoms. Second phase is the hypothesis rejection. The data which is gathered in the first phase needs to be re-evaluated so that if a particular symptom is not leading to any kind of cancer, it can be rejected. The third phase is the initial scoring heuristics. In this phase, the HCF, that is the highly critical factor, and the FCF, that is the formalized cancer factor, is generated. The is on a scale of 1 to 10, while the FCF is on a scale from 1 to 6. The fourth phase is the secondary scoring heuristics. In this phase, the scores of HCF and FCF which are generated in the third phase are re-evaluated and a final score is generated. The fifth phase is the supplementary information. In the score which is generated from the fourth phase gives the report whether the cancer is detected or not, along with some other supplementary information. Now, the inference engine. The inference engine is the brain of the expert system. Inference engine contains rules to solve a specific problem. It refers to the knowledge which is available in the knowledge base. It selects facts and rules to apply when trying to answer a user query. It provides reasoning about the information in the knowledge base. It also helps in deducting the problem to find the solution and formulating conclusion. There are basically two types of inference techniques. The first is the forward chaining. It is also known as a data-driven inference technique, as we reach the goal from the data which is available to us. In our cadet system, the data which is available are the symptoms, and the goals is to detect whether the cancer exists or not. The second method is the backward chaining, which is exactly the opposite of forward chaining. That is, it is a goal driven technique, as we start from the goal and divide it into sub goals to extract the facts. Now the next component is the user interface. The user interface is the most important component of the expert system. The user interface is the output window or the screen which is available to the user to get the output from the expert system. It may consist of natural language displayed on the screen, verbal narrations in natural language, list of rules numbers displayed on the screen. The above three can also be explained with the help of an explanation module. The UI system components include domain expert. A domain expert is the one or which has the complete knowledge about the domain subject. In our system, the domain subject is the cancer detection and its symptom. The second is the knowledge engineer. The knowledge engineer is the one which contains the information about the knowledge base, where it is stored and how it is used. And last is the end user. The end user in our system is the patient. Finally, the report structure. After the cadet algorithm is completed, the report is generated. The report structure consists of a personal and demographic data, list of elicited patient data. The report structure also contains the cancer alert list. This list displays disease hypothesis identified by the system as having sufficient weight to justify the physician's special attention. Cancer sites represented in the list are given by two types of score, the HCF and the FCF, about which we have discussed earlier. The patient findings related to the possible disease is also mentioned in the report structure. A summary of the American Cancer Society recommends for the early detection of cancer in asymptomatic people.
Now let us have a look at an example of the Cadet report user interface. In the next slide, I am going to show you the Cadet report of a 64-year-old male who took checkup at a nearby clinic where Cadet is operating. Before answering the Cadet questionnaire, he reported being in generally good health and did not have any other kind of complaints. His completion of the Cadet questionnaire showed that there were risks related to the lifestyle habits and several other symptoms which are shown in the reported findings. And the cancer alert table shows that there are high HCF scores for multiple myeloma, gastric cancer and esophageal cancer, pointing to the need for some diagnostic measures to be taken related to this cancer hypothesis. Here, as you can see, the reported findings for the 64-year-old male, which were based on the questionnaire and the cancer alert tables showing high HCF and FCF scores for 5 different kinds of cancer, with prostate cancer having the highest FCF score of 5.91. The cancer of the prostate received a maximal FCF score, indicating the high degree of attention to be paid to possible prostatic disease in this patient. The patient findings related to the cancer sites shows the various elements considered by the computer program with respect to this hypothesis. Only 5 cancers were able to pass the threshold of the HCF or FCF scores. In the last section, the report gives us a summary and the complaints suggested by the patient after seeing the report, which are not shown over here. So it can be concluded that the prostatic hypertrophy and reflux esophagitis were diagnosed and treated. Now, evaluation of Cadet, which was done by PubMed.gov, which is a US National Library of Medicine National Institute of Health, which said that based on the analysis of epidemic and clinical attributes of individual patients, the program presents physicians with various different data patterns which may help in early cancer detection. And after analyzing the patient data from a questionnaire of 160 healthy volunteers, it was shown that they were highly correlated to those provided by the clinicians. The computer's alert rate also kept going up as the number of physicians who raised the corresponding alerts. Thus, it can be said that the Cadet computer program may have a role in improving early cancer detection, which of course is pending the results of the further clinical research. Conclusion part. Despite a growing knowledge in cancer biology, epidemiology and screening strategy, it seems that not enough is being done at the level of primary care to prevent risk of cancer in early stages. The system aims to improve some of the difficulties, and it also improves the performance of the physician in this domain. Now, there are 3 ways in which cancer mortality can be reduced. The first is that recognition and intervention at the cancer risk level. The second one is elicitation and evaluation of early clinical signs and symptoms accompanied by routine procedures, which are suggested by the American Cancer Society. And the third way is proven efficacious treatment. The integration of all these elements could be important for an adequate clinical assessment, leading to appropriate preventive or diagnostic and therapeutic measures. The critical appraisal of the system's conclusions by the physician is essential and inherent in the process, which is achieved by the verification of the validity of cancer alarms and the high HCF and FCF scores evaluated for each cancer hypothesis. Thus, it can be said that the concept of computer-based approach in confronting perceived difficulties in cancer screening is proposed. The Cadet system represents a tentative implementation of this concept, and although the preliminary data seems to be encouraging, hard evidence from large-scale field evaluation studies is needed. Thank you.